Hello, and welcome to the Canadian Massage Conference pre-conference broadcast series on Massage Therapy Radio. I'm Felicia Brown, and I'll be your host for this interview and series. This is one of several broadcasts with the presenters and experts who are appearing at the Canadian Massage Conference, brought to you by the One Concept Group, November 4th through 6th, 2011, in Burlington, Ontario, Canada. I'd like to take this opportunity to thank the 2011 Canadian Massage Conference sponsors, the Vitality Depot, Lackner McClellan Insurance, Massage Therapy Canada Magazine, Biotone, Massage Warehouse, the Registered Massage Therapists Association of Ontario, and Hand and Stone for making this year's event possible. Our special guest today is Chris Nentarz. Chris and I will be talking about his 3-hour class at the Canadian Massage Conference, Kinesiology Taping, How to Effectively Extend Your Treatments. But before we get started, let me tell you a little about Chris. Chris is a sought-after physical therapist and performance enhancement specialist who holds over 12 years of experience working with athletes of all ages and levels. Chris is currently a consultant with many professional and elite teams and athletes in Canada and the United States. Moreover, he has presented at the international level on physical therapy and sports performance methods. He is adjunct faculty at Dieuville College, where he specializes in instructing sports orthopedics, integrated taping, and functional rehabilitation techniques. Chris is dedicated and passionate to an integrated approach to rehabilitation and performance, specializing in neuromusculoskeletal dysfunction. Chris, welcome to the Canadian Massage Conference pre-conference broadcast series. I'm really excited to talk with you today about your class, Kinesiology Taping, How to Effectively Extend Your Treatments.
Thanks, Felicia. I'm excited to be here as well, and especially excited to be part of the Canadian Massage Conference and pre-conference broadcast series. I know you guys have been working very hard to get this event off the ground, and it should be 3 days of fun and excitement, and I look forward to, interacting with massage therapists and making myself a better manual therapist while I'm there.
Well, you are definitely going to have that opportunity at the Canadian Massage Conference, Chris. I know that all of the organizers and myself are very excited to have you. We were just talking a little bit before we started the interview about your involvement in the NFL team players here in North Carolina, where I happen to live. And so I know that in addition to hearing about your wonderful expertise about kinesio taping, we are going to be picking your brain about NFL stories and stats and what to expect for the coming season.
Sure. It's certainly been a fun year, and it's fun to see from a practical side the different injuries that the teams are facing because of the shortened season and things like that. But one thing I will say, as a physical therapist, I certainly, recommend and, excited about the opportunity that massage therapists offer to our clients. And I really think having a good manual therapist could take a good athlete to a great athlete. So exciting stuff.
Well, wonderful. Well, as a massage therapist, I love hearing physical therapists talk about how we can benefit their clients as well. I don't know if you've been to the Canadian Massage Conference before, but tell me, is there anything in particular that you're looking forward to at this conference besides all the knowledge and classes that are available?
Yeah, besides that, I think I'm looking forward just to feel the, emotion and the energy of the people who are there, who are willing to share their passion for what we do. I think anyone who shows up for a 3-day event is looking to improve their game, and it's just fun to be around those people. And, I always have a passion for sharing my knowledge and expertise as well, and it's just going to be a fun time. And I think there's a private event going on, if I'm not mistaken, at a local dance club.
Oh, you're not kidding about that. And it's a fun one, too. And so you definitely have to make plans to stay for that and go out with all of us. It'll be a blast.
Sure, count me in.
So any particular reason, besides what you've mentioned, why you think registered massage therapists should attend conferences like the Canadian Massage Conference?
Yeah, I think the multiple disciplines who are going to be represented through the speaking engagements really will bring and elevate the quality of education there. I think everyone could really walk out being a better clinician on Monday after attending the event.
Most definitely. It is a great lineup this year. Lots of technical expertise and authorities from a variety of different perspectives. So it's going to be a really valuable conference. Now, I'd like to learn about what it is that you're bringing to this conference, and to get us started on your topic, can you just begin by telling me what is kinesiology tape?
Sure. Kinesiology tape is 100% cotton tape that is engineered to mimic the thickness, weight, and elasticity of human skin. We've actually been practicing kinesiology taping methods for over 30 years, but it certainly has gained a lot of momentum and press recently with the Beijing Olympics and some of the professional athletes who are using it now. The tape is 100% latex-free and hypoallergenic with an acrylic adhesive. This means it's water-resistant and breathable and can be worn for approximately 5 days. These characteristics are important, especially to my presentation, as the tape can be worn for multiple days. This helps us enhance and prolong our manual therapy intervention that we're using on the table well after the patients leave our treatments.
Well, that's really powerful. As someone that's getting ready to compete in an event myself, I'm thinking, maybe I should have gotten taped for this, something to help improve my performance. So you'll have to share some secrets with me. Now, you're taping somebody up for 5 days. What exactly does this do, or how does kinesiology tape work?
Well, I guess a lot of it depends on what your methods are and what you're finding through your assessments. We say kinesiology taping is essentially a systematic way of treating pain and dysfunction. We use the term system here as a way to contrast our methods from protocol-based driven treatments. Protocols are different and don't allow us to use our clinical judgment or expertise. And they're usually not based on an objective assessment. So they tell us to leave our brains at the door. And as therapists, we know that what we're thinking and what we're feeling is a very important part to getting our patients better. When we use a system, it gives us an opportunity to utilize our God-given talents and our skills in integrating various processes, progressions and necessary regressions. Kinesiology taping methods are systematic based on essentially 3 therapeutic effects. Those are being microcirculatory, structural, and my personal favorite, the neurosensory effect. The microcirculatory effect is achieved by using a lymphatic spider or a cross-woven pattern to treat swelling, bruising, and edema. This is done by improving superficial fluid dynamics and lymphatic drainage. This is best used, obviously, for acute traumas such as ankle sprains or back sprains. The second therapeutic outcome is a structural nature. Structural applications are best used to create changes in the hardware components of our patients and clients. Hardware components might include muscle shortening issues or postural issues that we see on a daily basis. These techniques will act to prevent potentially harmful ranges of motion without that hard end feel that you might get from using a brace or a different restraining mechanism. I personally like to use structural methods to achieve improved static and dynamic postures and optimize joint mechanics. When we use taping in this manner, we could improve joint centration or joint congruency, depending on what school of thought you're looking at. And last but not least, in my opinion, the largest value of kinesiology taping methods can be found in the neurosensory treatment effects. Neurosensory effects are implemented in almost every application. The tape provides an enhanced sensory stimulation, leading to a decrease in the neural perception of pain, essentially, through the sensory gaining mechanism that we're all familiar with. The stimulation, provided by wearing the tape, will help normalize neural drive to the muscles, that are involved in painful conditions or in dysfunctions after injury. Most of the conditions, we're seeing in the clinic are software issues. For example, alterations in global and local muscle tone is generally a software issue driven by the nervous system, and movement dysfunctions that we're seeing, such as shoulder hiking or, poor femoral control are other great examples. These software issues need software solutions. And kinesiology tape being placed in a neurosensory effect is a very powerful way to achieve those solutions over multiple days.
Well, to clarify what you've just said, because the way you're referring to this is a little different than what I've heard about kinesio taping in the past. So basically, you're looking at the neurosensory, which is about decreasing pain primarily. Then you have the structural, which is about creating changes in muscle balance or postural issues. And obviously that's going to have an effect on pain to a certain extent, but maybe that's not the primary focus of it. And then you have the microcirculatory, which again is probably going to have an effect on pain, but what you're really looking at is affecting circulation, whether that's venous return or lymphatic drainage in an injury site. Am I tracking on this? Am I getting it right?
You hit the nail on the head, and if
Okay.
you just were able to review and look at all those different things, we could treat a blend and a spectrum of different, clinical diagnosis or dysfunctions that are walking through the door.
Okay, and so what are some of the most common things you treat as far as conditions? I heard you mention the sprained ankle or maybe a broken bone, but what are some of the most common conditions that you see treated with the kinesiology tape?
Sure. I use, one of my favorite body parts, I would say, is taping the knee. We could very easily affect how the biomechanics of the knee work through taping the hip, treating symptoms and problems such as patellofemoral pain or medial meniscal derangements or any type of overloading issue of the major muscles or tendons in the knee. So those are very easy to do and very effective, and just like the knee, the shoulder, treating rotator cuff dysfunctions or, things like labral tears, it's very easy to do, and as anything, it's just a complement to what we're trying to accomplish in the clinic. So we could really utilize the tape in all those different manners to, enhance our results.
And what you were saying before about how this is a systematic way of treating pain versus protocols, what that sounds like to me is that the therapist or technician is actually assessing the patient or client themselves rather than saying, oh, this person has knee problems, here's the pattern that I tape in. Is that correct?
Oh, that's absolutely correct. We always want to try to assess a person and then intervene on them, whether it's with our hands or with using tape or with exercise, and then we want to reassess to make sure we made a change in our essentially our findings. We want to make sure there's clinical relevance in our techniques. That's one of the big things, we'll be talking about, and, some of the clinical pearls that bring about the optimized results, too, are going to be discussed.
That's great. I was going to ask you if you were going to be teaching some of those assessment techniques and not just the taping techniques.
Absolutely. Absolutely. What we want to do is try to take everyone from being sort of that preparatory cook to being a culinary genius, a culinary chef, and we'll do that by giving you essentially a cookbook, not a recipe or protocol to follow. So we'll talk about different things that you might see, whether it's with your hands or things that patients are, discussing. We'll talk about your integrated therapies and what do you do with assess now, and then how can you utilize kinesiology tape based on either taping someone in a structural, neurosensory, or microcirculatory fashion to help, achieve better results.
Right. So it's like if you're using that chef analogy, you're maybe teaching people a number of different tools that they can use to create a certain outcome, and it's up to them to decide based on the ingredients that the client brings to them which tool to use or which combination of tools to use to get the flavor that you're looking to achieve.
Yeah, that's 100% correct. We of course have certain procedures that we need to follow, and a lot of that will be based around and framed up by how we utilize the tape. When we tape someone up in a structural manner, typically what we'll do is place a joint in a certain position and then put a little bit of tension in the tape. Whereas when we tape someone in a microcirculatory or neurosensory fashion, we don't use a lot of tension in the tape. The biggest error that we see people make when they're taping somebody is using too much tension. So it's really important to know the little details that go into creating these changes. And as we all know, small things make big things happen. So learning how to be good with the tape and being great with tape are completely different things. And we're going to try to bring sort of that clinical classroom education and tie it together with that clinical expertise that bridge the gap to make sure we can do things to create changes in our patients. I think that's what things are about at the end of the day. We need to know sort of those different ways to accomplish that.
Most definitely. Well, you talk about little things making a difference, and one thing I know is that there are some types of tape that are pre-cut, and then there are other forms. Can you explain the differences between those and maybe how one might be better in a certain type of use or more effective than others?
Absolutely. My job where I travel a lot, I I originally was, it's important to know the difference and when to use what, because I need to pack those things with me. My original experience with tape came along working with the Hammarby football club in Sweden. So they're a big soccer club, and they were using tape in different formats, and they were cutting from a roll. And when it came time to work with my clients, I didn't always have that opportunity to carry scissors with me. A lot of times we're getting off the plane, and in some environments in different countries with these teams, we're getting taken right off the bus and right to the field. So I had to pre-cut my own applications using scissors and put them in a little Ziploc bag to carry them on the plane with me. And lucky enough, Spider Tech came along, and now other companies are using pre-cut applications. But the pre-cuts essentially save us time, which allow us to work with our patients and clients more, whether it's doing more manual therapies or educating them. We live and work in a time is money industry, and when we're taking time cutting from a roll, it can be detrimental to the amount and quality of patient care we're getting. There is, of course, going to be times you need to cut from a roll. I tape guys who are very large, guys who are 6'7", 280 pounds, 300 pounds, and sometimes the pre-cut applications when someone falls really in that size scale doesn't work. So I will stop a roll. You can imagine some of these guys are very big. If they want to put the postural spider on, they sneeze and it's going to come off on them. So I need to go to the roll for these big guys.
I can totally understand that. You have to work with the patient where they are. It can't all just be, but I've got these pre-cut pieces. We have to just deal with that.
Yeah.
So now, Chris, are there any contraindications to using kinesiology tape?
Well, I'll tell you what, there's not a whole ton of them. The big thing is knowing how to use it the right way. To get the best result, knowing some of the secrets and the wisdom and the clinical pearls, but the really true contraindication is skin, looking at the skin. You have to make sure there's not an open wound. You probably wouldn't want to tape someone who has very hot, irritated acne, nor would you want to tape over a sunburned area. That just makes sense. The tape is hypoallergenic and it's designed not to react, but typically those are really the main contraindications. You will get a small percentage of the population that will react. It's going to be 2 or 3%, and the same type of people who react to Band-Aids, and they're just sensitive to adhesives, and that's the way it goes. There is gentle products out there that utilize a gel-based adhesive, and go check on. I think the Spider Tech website will have those on there. That's sort of a good resource for people to use, but. Again, getting back to that contraindication, we just got to look at the skin and be smart when to not use it.
Well, you definitely have to use your common sense in working with clients anyway, and this is no different. But it sounds like it's really a well-rounded sort of application that can be used for a lot of different things. Now, I know people are interested in learning about what you're going to be talking about specifically in your class at the Canadian Massage Conference. Can you tell us a little bit about that?
Sure.
To cover?
Yeah, well, first and foremost, we're going to cover the basics of why the tape works and how you could utilize it. We're going to cover the 3 ways to apply the tape based on structural, neurosensory, or microcirculatory fascions. And then we'll get into some case studies and talk about how we could utilize combination treatment techniques to affect change on movement patterns. And also to talk about how we could regulate muscle tone over a period of 3, 4, 5 days. So that way when the patients get off the table, they can continue to receive good input. It's very powerful. So we're really going to tie those things together for everyone.
Well, it sounds like there's going to be a lot of valuable information there. For anybody that's interested in kinesiotaping or taking your class, do you have any advice for them now about anything that they should look into or consider before getting involved in kinesiotaping?
Yeah, absolutely. If you go to spidertech.com, there's a free e-learning module that practitioners can take. It takes, an hour and a half to 2 hours to get through, but it really speaks eloquently about the neurology of why the tape works and some of the underlying mechanisms and the rocket science portion of why the things work. And, once you create a stable foundation and understanding of things, I think it's easier to get into some of those clinical pearls. But I would recommend that they take that and just continue to look at movement in a new way. Think about movement not being necessarily hardware driven where it's muscle length and things like that, but being software driven. So understanding that timing and sequencing through nervous system modulation is very important, and then understanding how we could accommodate and tie into the nervous system by stimulating the sensory system. Being open-minded to that and maybe doing a little research on their end before they get to the convention. That way it can be more about expanding the clinical knowledge and going sort of from that level of good to great.
I think that's all great advice. Personally, I'm thinking, should I go get taped so I can experience it firsthand, or should I just wait until I get to the class to be taped?
Absolutely. Well, the great thing is we're going to do a lot of hands-on applications. My goal is to really make, 80 to 85% of what we're doing over the 3 hours hands-on. We need to know how to use this stuff, and we need to get comfortable with it. We need to, make a couple mistakes, maybe, taping our fellow practitioners before we tape our clients. So, but I think that's part of the design of the course, and we are really getting you to be able to change the way you practice on Monday. And, maybe we could talk about what you're doing from a training standpoint and get you up in front of class. I'm sure the audience would love to have you.
Well, feel free to use me as a model anytime. I'm happy to be taped, rubbed, massaged at any point during this conference. I've made that offer to several of the presenters, so maybe I'll just go from one table and classroom to the next, and I might be a little bit overloaded, but I think it sounds great. I really want to experience it, and it's something I'm shocked that I haven't had a chance to get that before, but I definitely am interested in helping out however I can.
Great.
Now, Chris, you mentioned a website before for Spider Tech, but I want to make sure that for those people who aren't able to attend the class or who want to learn more about what you do and kinesiology taping in advance of the Canadian Massage Conference, can you share that website with the spelling as well? And then if there's any contact information or website information for you, we'd love to have that also.
Yeah, sure. I'm a pretty humble guy, and I'm 150 emails to 175 email a day guy answering, questions from practitioners like those out here listening. So please just email me, and my email address is going to be cnentarz@hotmail.com, and I'll run that down for you. It's C, N as in Nancy, E as in elephant, N as in Nancy, T as in Tom, A as in Apple, R as in Ralph, and Z as in zebra @hotmail.com. And the website that I did mention before is spidertech.com, SPIDERTECH.com, spidertech.com.
Great. Thanks for sharing that and spelling it all out. There's so many different spellings of things where people try to be cute and quirky with websites. I just wanted to make sure that we had it right.
Absolutely.
I know that people listening are going to want to take your class, Chris, and so now I'd like to just tell everybody a little bit about the conference and how you can register to take Chris's class as well as the other classes at the Canadian Massage Conference. In fact, the Canadian Massage Conference is Canada's largest exhibition of massage products, continuing education, and new business opportunities for therapists of all disciplines. This year's conference will feature over 50 exhibitors, continuing education classes of 1 hour, 3 hours, and one-day workshops, including Chris's, as well as Friday and Saturday night receptions, and a private dance party at Club 54's Retro Room. That's what we were talking about earlier. That's adjacent to the conference hotel and definitely an event not to miss. The registration cost for the conference is just $40, which includes admission to the trade halls and all 1-hour presentations, participation in raffles and giveaways of literally thousands of dollars in prizes, between class coffee breaks, and loaded goodie bags. Attendees will also have access to many special offers and promotions from the vendors and exhibitors, as well as the chance to have a fantastic time with friends and colleagues. Now, for students, the conference offers a free student day and Smart from the Start program on Sunday, which is sponsored by Massage Warehouse and the Registered Massage Therapist Association of Ontario. This day is dedicated to massage therapy students who are currently enrolled in school or who graduated in 2011 and includes a free gift bag for the first 250 students. Also on Sunday, the RMT Career Fair, sponsored by Hand & Stone, will be held from 1 to 3 p.m. and is free to all registrants, including students. All of this is happening at the Conference Hotel. That's the Burlington Holiday Inn, and I definitely suggest you make plans to stay there if possible. Single or quad rates are just $121 a night, but space is limited, so please make your reservations now. Also, Massage Therapy Canada is printing the Canadian Massage Conference event program inside an issue of their magazine. This will be given out at the conference and distributed throughout Canada to over 5,000 registered massage therapists. So if you are a vendor or educator who is listening in today and you want to get some great exposure for your products or classes, please contact Christine Livingstone at Massage Therapy Canada for details on being a part of the conference program. Now, if you're ready to register for the Canadian Massage Conference happening November 4th through 6th in Burlington, Ontario, to meet Chris and the other amazing presenters at this year's event, there are now 2 ways to do so. First, you can register online and pick your courses instantly at the at the official conference website at CanadianMassageConference.com. You can also register by phone. The call is free and operators are waiting to talk to you at 877-387-9111. That's 877-387-9111. We also invite you to stay connected with us on Facebook at facebook.com/Canadian Massage Conference. Again, the Canadian Massage Conference of 2011 is made possible by all of our wonderful sponsors. Thank you so much to the Vitality Depot, Lackner McClelland Insurance, Massage Therapy Canada, Biotone, Massage Warehouse, the Registered Massage Therapist Association of Ontario, and Hand and Stone. I hope after today's broadcast, everyone listening is ready to come to the Canadian Massage Conference and register for the 3-hour class, Kinesiotaping, How to Effectively Extend Your Treatments with Chris Nentarz. Chris, thanks again for taking time to be with us today and for sharing your knowledge about kinesiology taping with everyone. I'm really looking forward to being a model in your class and seeing you at the Canadian Massage Conference in November.
Well, I'm looking forward to it too, and really honored to be part of this event, and thank you so much. And I hope all the listeners out there come by and learn really how to take their kinesiology taping to the next level.
Me too. It's going to be a great class and event. Everyone, this is Felicia Brown, and on behalf of everybody from the Canadian Massage Conference and Massage Therapy Radio, I want to thank you for tuning into this broadcast of the Canadian Massage Conference pre-conference broadcast series. Please remember to tune in each Monday through October 31st for more interviews and to visit MassageTherapyRadio.com for replays of all the interviews in the series. We look forward to seeing you in Ontario in November. Please also consider joining us for the American Massage Conference, April 20th through 22nd, 2012, in San Diego, California. Thanks again for tuning in, and have a fabulous day.